Hey guys, my name is Todd Derry. This is TD's Fat to Fit, your free online strength and conditioning coach in your pocket. We're going to continue with peptides today, speaking about specifically semaglutide and Tirzepitide, the new weight loss drug that everybody seems to be on at the gym, on the news, in Hollywood. What is it? Ozempic, Wegovy, Mounjaro. You see them all over the news and on TV and commercials and such. So I thought I'd do a deep dive, give you guys an idea as to what makes them work, how they work, what's the history, how effective are they, a couple side effects to talk about, a few legal issues that is going on currently. But let's do a deep dive on semaglutide or Tirzepitide. But as you know, I'm not a doctor. Cops be pulling up like I'm passing out drugs. Nah. I'm a bodybuilder, not a doctor. This is completely for education and entertainment purposes only. This is just my experience with people that I've trained and been a coach to that have taken the peptide and the drug, had some good experience with it, and overall my research and investigation as to how they work, when they were developed, when they were introduced in the FDA status, the legal status. And as always, please like, share, comment below, and definitely hit that subscribe button. That will help me out tremendously. But let's get into it. Semaglutide and Tirzepitide. The brand names that we're going to talk about are Ozempic, Wegovy, Trulicity, Mounjaro, Victoza. The compounds are, again, the GLP-1 mechanisms are called semaglutide, Tirzepitide, and the first one was called liraglutide. So the history, it's interesting. GLP-1 drugs were initially discovered in the gut in 1983. However, the human grade or the human GLP-1 has a very short half-life. So they saw that the Gila monster, this Heloderma lizard, has the GLP-1 in its venom. And they saw that this lizard can go for very long periods without eating. And so they were able to derive this GLP-1 peptide with a form that was derived from this Gila monster. First studies and clinical data for human populations came out in 1987-88. So the development of these drugs started with liraglutide. It's the first synthetic compound. Liraglutide is a 30 amino acid chain, but the problem with liraglutide is it has a short half-life of like 1.5 hours. You'd have to do 20 injections a day to keep high concentrations, enough to do anything. So that's not feasible. So scientists tested the Gila monster, which is like 53% similar to human GLP-1, which extended half-life dramatically out to a day. So semaglutide is when they took the liraglutide with the Gila monster derivative to it and added albumin. Albumin is a very durable protein within the blood, and it is the backbone of semaglutide, and that got the half-life out to about 7 days, and that's why you can now see weekly injections. So the mechanism of action of GLP-1s, glucagon-like peptide-1 agonists, is they are very similar, all of them, but they have different half-lives. Injections vary daily or weekly, and some are pill form, which have different protocols. GLP-1 acts on receptors in the gut, mimicking what the body releases when eating and senses a full stomach. Semaglutide has several different effects. Insulin production, which reduces glucose in the blood. It inhibits glucagon, which reduces gluconeogenesis in the liver. It also senses the stretching of the stomach, which suppresses ghrelin. Evidence shows they can grow more pancreatic beta cells, which are also responsible for insulin production. So it upregulates insulin production and sensitivity. GLP-1 receptor activation blocks the release of ghrelin, suppressing your hunger, and also having an inverse reaction to leptin. So it releases leptin, which is your full hormone. So again, when your stomach is empty, when you feel that hunger feeling, that's ghrelin. And then when you feel full, that's leptin. So this is synthetically changing those hormones, even though there's nothing in the gut. And that's kind of that where you go back to the Gila monster. It can last for months and months without eating. That's how it's able to do that. GLP-1 also has an anti-inflammatory effect, a slight diuretic effect, and a vasodilatory effect. 2023, there were 6 studies that showed a reduction in systolic blood pressure. It increased kidney function and oxidative damage. Both of those are pretty good. And obviously, reducing blood pressure at any level is a good thing, but at what cost? So current FDA status, it's approved for the treatment of type 2 diabetes and weight loss. It's approved to buy. You don't need a prescription through normal compounding pharmacies or peptide companies, but that's what the FDA recommends. Get a prescription, talk to a doctor, and get it the normal route. And that way you'll get name brands from it, but you can buy it anywhere all over the internet. You can get it very available on the internet. As of 2024, there are 9 brands available with FDA approval, and they strongly recommend getting the peptide through and with prescriptions with a doctor's advice and guidance. Obviously, brands like Ozempic, Mounjaro, Victoza, Trulicity, there's a bunch of them. And they all have different FDA approval dates because they were all developed at different times. But they all basically treat type 2 diabetes, weight loss. Some are FDA approved in children, some are not. And the average cost in the US is about $1,300 to $1,400 a month. And that's where the Semaglutide, Tirzepitide peptides come in. They're much cheaper. They're probably still in the hundreds of dollars, but they're not $1,300 because you're not buying a name brand. And that's when you get the issues with the FDA. But you can buy them. You can buy them anywhere on any internet site that is selling peptides. It's not illegal, and you can buy them. Legal status in Europe is a little different. Wegovy is the only semaglutide treatment approved for weight loss in France, Germany, Denmark, and Switzerland. Britain and Belgium have temporarily banned its use for weight loss because there's a shortage of the drug and they want it only for type 2 diabetics. So the shortage is creating an issue for type 2 diabetes. So they've made it illegal for weight loss patients. Average cost in Europe is about $300 to $400, which is more like probably the off-label cost in the US. However, there's some legal trouble. There's an Ozempic lawsuit. I'm not going to get into details, but the Ozempic lawsuit covers pancreatic cancer, gastroparesis, which is permanent paralysis of the stomach. Yeah, I don't think so. Ileus, which is motility or the stoppage of motility in the small bowel. Bowel obstruction, another thing you don't want. This is a picture of it. Bowel obstruction is something that would lead to impaction and then perforation, which is basically shit getting broken open. It breaks through the colon or small bowel because it backs up, and then it would perforate the colon, and then you'd go septic and probably die. Not a fun time. If anything, it would be extremely painful, and you'd have to go get surgery to have it surgically removed. Other issues are pancreas and thyroid patients are not allowed to take this because of the cell growth that happens within those patients. And then also the gallbladder has issues. You get gallstones and such. So there are several side effects. First, let's get into the benefits. There's increases in protective neurons, alleviates depression, improves cognitive function, prevents neurodegeneration, decreases appetite, reduces stroke risk. In the liver, it facilitates lipolysis, reduces inflammation, reduces gluconeogenesis, increases glucose uptake, increases synthesis of free fatty acids. The intestines, it decreases appetite, slows gastric emptying. I'm not sure if that's a benefit, but that's what they say. It stimulates insulin secretion and suppresses glucagon secretion. In the heart, again, reduced hypertension, that's a good thing, protects cardiovascular disease, increases cardiac output, something also very good. Pancreas, it decreases B-cell apoptosis, which is the genetic killing off of cells, stimulates insulin secretion, increases insulin sensitivity, stimulates B-cell production or proliferation. So it actually, and that's where the pancreatic cancer issue comes in, because if you're calling for cell proliferation or cell growth, if that becomes unbridled or out of control, that's cancer. And sorry, pancreatic cancer is not something I want to deal with. Improves insulin biosynthesis and suppresses glucagon secretion. However, 89% of people experience these bad side effects. Facial aging, which is the Skeletor face that you can see from a mile away, all their eyes are sunk in. Dysphagia, which is difficult swallowing, diarrhea, kidney disease, thyroid cancer, pancreatic cancer, nausea, gallstones, headache, chills, hypoglycemia, constipation, dizziness, fast heart rate, indigestion, hair loss, blurred vision, confusion, fatigue, bowel gas, bloating, and dizziness. There's more. I just thought that was enough because it was just like, okay, I get it. But the fact is that 89% of people experience these side effects. So maybe doing less of the recommended dose might help. I don't know. But these are pretty dramatic side effects that I don't know if I could entertain for the first ramp-up period of almost 2 months. So once you get used to the drug, I'm sure they subside. But that's the problem with some of these, is that's what the lawsuits are for, because they're showing that some of this stuff is permanent. The gastroparesis, the stomach paralysis, is permanent in some patients. So let's get into the differences between semaglutide and tirzepatide. So semaglutide is a GLP-1 receptor agonist, mimicking the naturally occurring GLP-1 hormone found in the body. Tirzepatide, however, works in a two-peptide, two-backbone way. It's a GLP-1 and a GIP receptor agonist. What's GIP? GIP is a glucose insulinotropic polypeptide. Say that 10 times fast. It increases insulin secretion, it increases insulin sensitivity, suppresses glucagon like a GLP-1, slows gastric emptying like semaglutide, significant reduction in HbA1c. It's more productive in the insulin side, so it helps lower HbA1c, which is your average glucose level over a period of time. So you get greater weight loss, you get greater glucose control, and improves cardiovascular risk even more. So overall, I feel tirzepatide is the better of the two drugs because it doesn't just act on the ghrelin, leptin, gastric emptying mechanism. It also is much more improving on the insulin side, which is the controlling of sugar in the blood, glucose. Dosages of semaglutide, Ozempic, and Wegovy. So there's two different protocols. One is for weight loss and one is for type 2 diabetes. For weight loss, you start at 0.25 milligrams per week for the first 4 weeks. So the first month is 0.25 milligrams. Then you bump it up 0.25 milligrams each week from week 5 to 8. And then once you get to 1 milligram, you keep it 1 milligram for 3 weeks, 9 through 12. Or is that 4 weeks? Yeah, 4 weeks. So for another month, you're going to be at 1 milligram. And then you go up to 1.7 milligrams from week 13 to 16. And then your maintenance dose is at 2.4 milligrams per week from 17 weeks on. But if you miss a week or you miss a dose, within 5 days, you're supposed to take that dose or skip it. If 1.7 milligrams a week is too much and you're seeing too many side effects, discontinue treatment. Get off the drug. It's not going to work. For type 2 diabetes, it's a little different. Type 2 diabetes, you take 0.25 milligrams per week for the first 4 weeks. You increase it by 0.25 milligrams per week up to 2 milligrams of a maintenance dose, or wherever you get glycemic control, that's where you stop. But your max is 2 milligrams a week. Tirzepatide is a little higher concentration. Tirzepatide, you start at 2.5 milligrams per week for 4 weeks. You increase it by its amount, 2.5 milligrams per week from week 4 to 8. And then you do not exceed 15 milligrams a week. And the duration would be 12 to 24 weeks. So again, you start at 2.5 and you go up accordingly after 1 month. And once you get to 15 milligrams a week, that's your maintenance dose of tirzepatide. And tirzepatide is Mounjaro and Zepbound. There's also dosages of liraglutide. Liraglutide is a daily injection. You start with 0.6 milligrams for the first week, go to 1.2 milligrams for the second week, 1.8 milligrams for the third week, 2.4 milligrams for the fourth week. And these are daily injections. And then your maintenance dose is 3 milligrams per day, week 5 continued. And that is Victoza. That's a daily injection of liraglutide. So in my BPC 157 video, I theoretically showed you how to reconstitute the powder once you receive it. So if you're not going to buy Mounjaro, Victoza, the brand name, and you're going to go through a peptide company, you're going to receive it in form like this. You're going to get a little vial with some powder in the bottom of it. This is the constituted form. You need to reconstitute it in bacteriostatic water. So you'll need to buy a bottle of water, and then you get, obviously you buy the peptide from whatever company you're going to get it through. So let's say this is 2.5 milligrams, which it is, of semaglutide. So what you want to do is you pop off the top of the bacteriostatic water, always wipe it down with an alcohol swab, safety first. Wipe them 2 down, right? Pop off the top of the small vial. Both of them have little rubber stoppers, right? Wipe it off, and you're ready to go. I sometimes wipe my hands with this too. And then take your syringe. This syringe is 0.5 milliliters. So it's a half a cc in this. So I'm gonna have to do this twice. If I'm gonna fill this up with 1 cc of water, I'm gonna take this, put some air in it, pump the air in, put it upside down, take a half a cc, fill it up, and so that's 0.5. I'm gonna take this, now I'm gonna put this in sideways so that way it doesn't squirt directly into the powder. Why do I do that? Because it's delicate. It's a delicate protein, and if you squirt straight in, it can hurt the powder or the protein. So you don't want to do that. So typically there's a little gap in the rubber stopper. So try to find that gap and go sideways. So like this. You're gonna poke it in sideways. Sometimes it takes it in by itself. See, it's just taking it by itself. Let it squirt, and you want it to squirt on the side of the wall. Look at that, it's just pulling it in because it's got a vacuum. Take this out and do that one more time because I want 1 ml of water in this. Now it only has 0.5 mLs. So I'm gonna do that one more time. These are tiny little needles, so you don't feel them. I think these are 31 gauge, 0.5 ml, 1/4 inch. Tiny, but it doesn't matter because you're just trying to get it under the skin. It's just subcutaneous injections, no big deal. Doesn't hurt, typically, doesn't hurt. Again, sideways, put it in sideways. And again, it's got a vacuum in it, so it pulls it in. And as you can see, it's squirting in sideways. It's hitting the glass, not the powder. And it just pulls it in. You don't have to squirt it in fast. Don't be violent with it. You paid some money for it. You want it to be as effective as possible. And here you are. Now there's a little white on the bottom of that. The way I typically do this, I just sit here and roll it. You don't want to shake it up. Don't shake this up. Because again, if you shake it up, it'll break the protein and make it less effective. The effectiveness of the protein is if it's stable and if it's in good condition. If it's all broken down little fragments, it's not gonna work. So roll this up until all the powder is formed. Now your first injection of semaglutide is a 0.25 milligram injection first week. As I said, it's 0.25 milligrams per week for the first month, and then you go up by 0.25 from there. So this is 2.5 milligrams in 1 ml. How much is 0.25? Think about it. 0.1. How much is 0.1? I will show you. I'm not going to take this right now. I could. I will. Just to show you. How much is 0.1? Here we go. See, there's still a vacuum in there, so I gotta push some air in there because it's still not pulling out. I'll put some air. And just, again, pull some air in, push it in. Look at that. That's how much of a vacuum they create. So I'm gonna do that again. Do that one more time. And so then it should come out easily. All right, let's see it. Now, 0.1. How much is 0.1? 0.25 milligrams. Right there. 0.1 on this is 0.25 milligrams. And I'll do that for 2 weeks, and that will be, or excuse me, I will do 0.25 milligrams for the first 4 weeks. And that way you can just figure out, well, how much water you're going to put in, how much do you need? But that's all you need. You can put it anywhere. You can put it in your shoulder or whatever. You can put it in your gut. It's very easy. You can put it anywhere. You want to put it in your skin like this? Look, watch this. Done. It's that easy. Very simple. Doesn't hurt. And now you're done. Until next week. What they tell you is to do it at the same time, on the same day, in the same area. Typically, I'm not going to take my shirt off and do that. Typically, you want to do it around your belly button. You want to do most injections around your belly button. That's why it's always covered up. Sometimes you have a little bruise or whatever, so it's always covered up. But you do it around your belly button. There's a lot of fat typically around there. There's a lot less nerves down there. It hurts less than your hands or whatever. But you can literally do it anywhere subcutaneous. Anywhere under the skin is fine. It will go systemic. So I just wanted to show you how to reconstitute this stuff, because when you buy it off-label or no name brand, you're just going to get this little tiny bottle full of powder. You're like, what the hell do I do with this? So again, buy reconstitution solution, bacteriostatic water. Again, why? It's been treated with benzyl alcohol, so there's no bacteria in this, and the bacteria will eat the protein over a period of time. What am I going to do with this now? I'm going to go put it in the fridge, and this will last me for as long as I need. 0.25. It'll last me 10 weeks if I keep doing it that dose. So I'm going to keep this in the fridge. It'll keep it cold and it'll keep it stable. Use bacteriostatic water, again, because 10 weeks, if there was any bacteria in this water or tap water, it will eat the protein in here, and then you're basically injecting water. You don't want to do that. You want this stable compound that you're injecting. You know what it's going to do. My conclusion, obviously it works, but it works almost too well. For type 2 diabetics and the intervention needed, if this fixes your problem, awesome. It's going to reduce your calorie intake. It's going to reduce your total food intake. And once you get glucose control and you really start to be more active, and maybe you start to work out and eat healthier, maybe you can get off. Unfortunately, these drugs are not meant to get off. These drugs are labeled to be on continuously. They don't have an exit strategy, unfortunately. And that's why some of these patients that are getting off this drug after they see they can't handle the side effects are getting long-lasting side effects that are not going away. But however, for weight loss, it's different. This is an extreme way to lose weight. In my opinion, it's better than surgery. Anything's better than surgery. There are many side effects which 89% of people experience. The beneficial side effects are too extreme because you lose not only fat, but muscle and bone, not just fat. Metabolism slowed dramatically, making it a huge risk to discontinue. And then as soon as you stop therapy, you'll gain all the weight back because your metabolism has crashed. And there's so many other natural ways to do the same process, to get the same reaction. To have the same reaction as a GLP-1 agonist, go on a carnivore diet, a keto diet, or low carb program. Start working out, because your body will suppress ghrelin and release leptin the more fat metabolism that occurs. That's the whole process of a keto diet or carnivore. You're eating so much fat, the fat metabolism creates leptin, suppresses ghrelin. It's the whole process. The whole point of this is you become much less hungry on a keto, carnivore, no carb diet. So you can do it in many other ways. And you're not, that's the way you got to think of this. Are you deficient in a GLP-1 agonist? Is that why you're fat? Probably not. You're just eating the wrong foods. If this is a last-ditch effort and you are extremely obese and you have glucose out of control, fine, have a blast, go for it. Hopefully it helps, but try to have an exit strategy. When you decide to make this type of life change, you should weigh all the options. Look at pros and cons of everything. Look at diets, look at drugs, look at surgery, workouts, athletics, go to the gym. Decide what is right for you, not just for today, but for tomorrow and the rest of your life. What will be healthy for you today, strong and healthy, and for your future? We spend our entire life trying to get fit and lean and strong, yet you're going to take a drug that literally consumes muscle and bone. You have no idea the long-term side effects, because we don't know, because all these drugs were FDA approved in 2019, 2023, 2020. These are really new drugs. So we don't know long-term side effects. And if we're already seeing gastroparesis, pancreatic cancer in short term, what's long-term use going to be like? Not to mention the fact that you're going to get rid of all the muscle that you've tried to gain over years. And at the older age, that's all we care about is muscle mass. Because if you lose muscle mass, your metabolism slows down, you become weaker, and that's the whole point of sarcopenia and wasting disease and getting older. It's something we try to fight for the rest of your life, and you're going to take a drug that's dramatically going to increase that muscle wasting? I don't think so. So, again, what is your exit strategy? think and have a plan and decide what that strategy is. We are free to make decisions. This is our own body. We should be able to do anything we want, whenever we want. It's our own body. We are free and able to do this. Good or bad, this is our own body and we should be able to do whatever we want. And it seems like that's not the case in 2024, but that's a different story. However, I'm a big proponent. We should be able to do anything we want. You feel this is right for you, go for it. It's better than surgery, but have an exit strategy. Try not to use the recommended dose. I have heard and seen some functional medicine doctors talk about a 1/10 of the dose, having a very similar effect. You still get the positive side effects with drastic reduction in bad side effects, and they're only using 0.1 of the recommended dose. I think that might be a more smart therapy than trying just to go right to 2.4 milligrams if you're using semaglutide or 15 milligrams on Tirzepitide. Try using 1/10 of it. Just teaspoon it and see if you get the effect. If you do, perfect. And then if you need to get off or you need to stop because you've lost the weight, great. And along the way, the most important thing that I want you to take away from this is you need to increase the amount of protein you eat. You need to increase the amount of fats you eat, because this is going to make you full all the time. So you're not going to want to eat. And that's why this consumes muscle. Start working out. Go weight train. Lift as heavy as you possibly can, like your life depend on, because it does. Again, carbs are the enemy. Fats are your friends. Protein is your family. Fats come and go. You pick and choose. Proteins, you eat them as much as you can. And even if you're on this GLP-1 drug, you're not going to be hungry. So you're going to need to make sure you're getting the right macros, proteins and fats, to keep your energy going, and weight-bearing exercise so you can make sure that that muscle wasting side effect of these GLP-1 drugs is not going to be that dramatic. Or you can stop it completely. So that's my takeaway. Hopefully this was worth your time. Hopefully you learned something. Please like, share, comment below, and definitely subscribe and help me out grow this channel. My name is Todd Derry. This is TD's Fat to Fit. Until next time, talk to you soon.